Hello, and thank you for joining me today. My name is Amy Prochi, and I am the Program Manager for the Exceptional Family Member Program, or EFMP, for the Marine Corps on Joint Base Meyer Henderson Hall. Today's presentation is designed specifically for medical providers who may be asked to complete EFMP paperwork for their patients. The goal is to provide you with a clear understanding of EFMP enrollment criteria, as well as the documentation required to ensure accurate and timely processing. So let's go ahead and get started with our presentation. The Exceptional Family Member Program, Provider Brief, Enrollment Criteria and Documentation. So what is EFMP? EFMP is a Department of Defense mandated program that supports military families who have special medical and educational needs. It also plays an important role in the assignments process by coordinating to ensure that these needs are met and considered before a service member receives orders. The overall goal of EFMP is to make sure that families have access to required services, maintain continuity of care, and support family readiness. So now that we know what EFMP is, let's find out why it matters. EFMP directly impacts duty station assignments, helping ensure families are sent to locations that can meet their needs. It also helps prevent gaps in care, especially during moves, by making sure services are available ahead of time. And ultimately, it supports the mission because when family members are supported, service members can stay focused and ready. EFMP enrollment criteria. The governing reference for the Exceptional Family Member Program is the DoD Instruction 13-15-19, which outlines the specific criteria for enrollment. A family member qualifies for EFMP enrollment if they have a chronic medical condition lasting longer than 6 months that requires ongoing care. This can include care from a primary care provider at least once a year or by a specialty care provider. Enrollment is also required for individuals with developmental disabilities, behavioral or mental health conditions. This includes mental health conditions that have improved and no longer require active treatment. Continued enrollment is still required for 5 years after the last treatment, so that can include medication or therapy. And in situations like this, it's important to list the month and the year of the last treatment when updating the paperwork. And that starts the clock, the 5-year clock. Additionally, a child receiving special education services with an individualized family service plan or IFSP or an individualized education plan in IEP also qualify for enrollment. And then finally, any family member with a condition requiring specialty care meets criteria for enrollment in EFMP. This slide highlights examples of medical conditions in family members, both children and adults, that would require enrollment in EFMP. So this is not an all-encompassing list. This is just a few examples, but we'll go over that. So some medical criteria would be asthma, diabetes, seizure disorders, cardiac conditions, cancer. Developmental and behavior criteria could be autism, ADHD, speech language delays, intellectual disabilities, or a need for therapy, OT, PT, speech, or ABA. And then mental health criteria could be depression, anxiety disorders, behavior disorders, or any psychiatric needs. And then educational criteria would be a child receiving special education services with an individualized education plan, or a child receiving early intervention services and has an individualized family service plan or IFSP. On this slide, we're going to discuss the required forms to enroll in the program. So the DD 2792 is our medical enrollment forms, and these are where you as the medical provider are going to document the family member's current medical history to include the types of providers they see and the frequency of care. This form is required for both adults and for children. And then the DD 2792-1, that's the special education enrollment form and is completed by the school or early intervention provider. And this is for children who have an IFSP or an individualized family service plan and are receiving early intervention services, or children that have an IEP or individualized education plan and are receiving special education services at a public school. So what are your responsibilities as the provider? It's to complete the DD 2792 to identify qualifying conditions, provide accurate diagnosis, document care, and complete the forms thoroughly. In the next few slides, we're going to discuss pages 4 through 8 and how to complete them. And if you're ever unsure if a family member meets criteria for enrollment in EFMP, it's better to go ahead and complete the DD 2792 and then let the medical screeners at the different branches of service, EFMP office, to review the documents to determine whether that family member meets criteria for either initial enrollment, update, or disenrollment. EFMP paperwork must be updated every 3 years or sooner if there are changes in the medical history, the types of providers that family member sees, the frequency of care. Maintaining current and accurate information helps ensure that the appropriate medical services are available at that next duty station. Pages 4 and 5 of the DD 2792 are used to document the family member's current medical history. This includes the diagnosis, the ICD-10 code, the prognosis, the number of visits in the last 12 months, medication, and the treatment plan. Please be as detailed as possible when completing this section. A common issue that we see, especially with children with autism, is that the provider will just list autism, but then will not provide any additional information about how that condition impacts that individual. And as you know, what autism looks like in one individual can look very different in another. So it's very important to provide detailed information documenting the relevant functional details, such as whether the individual is verbal or nonverbal, if there's any safety risk to themselves or others, or the ability for that individual to perform daily acts of living. Providing thorough information about how the condition impacts the individual helps determine the level of need for services such as respite care and priority housing placement. This slide shows a copy of page 6 and page 7. On page 6, this is where you're going to provide additional details about certain conditions to include asthma, behavioral health conditions, autism, or significant developmental delays. If the family member you're completing the 2792 for does not have any of these specific diagnoses, you can indicate NA and then move on to page 7. And then on page 7, this is the page where you're going to list all of the providers that that family member sees and then the frequency of care. So at the top of page 7, there's a legend where you will indicate the frequency. So W for weekly, Q for quarterly, A for annual, and so on. All providers listed on this page should correspond with a documented diagnosis from page 4 or 5. It's also important to note that when completing page 7, if you could please avoid using as needed or PRN when specifying the frequency, and rather use one of the either already determined frequencies, or leave that particular provider off altogether if it's something that's not necessarily needed at this time. The reason for that is PRN and as needed, the screeners, when they're looking for care, they have to assume as needed or PRN is the most frequent visits, which that then narrows down the search area for care. This is page 8, and this is where any housing and environmental or medical equipment needs are going to be listed. For housing accommodations, you're going to go ahead. Those would be some examples would be single story home, limited stairs, air conditioning, or specialized air filtration systems. When indicating temperature-related requirements, it is helpful to specify the exact temperature range and note that if that is needed 24/7, 365. This is also where you're going to list any medical equipment. Accommodations and equipment listed on this page should correspond with documented diagnoses on page 4 or 5. It's also important to note that we prefer that the primary care doctor is the one that completes the DD 2792, and the reason for that is that it is assumed that the primary care doctor has a overall comprehensive view of the family member's entire medical history, instead of just like if you had a condition where you were seen by an endocrinologist, they're only going to necessarily know about the conditions that are under their purview. So it's better to have the primary care doctor complete the 2792. It's not saying that we wouldn't accept a 2792 completed by a specialty care provider, but what's going to happen is the family's going to then be requested to go back and have their PCM complete an additional 2792 to capture any other medical conditions that there might be. So EFMP DD 2792 submission process. So every branch of service has their own process for how paperwork is completed. So I'm going to discuss, since I'm a representative of the Marine Corps, I'm going to discuss how we request that the paperwork be submitted. So a family member, when they come to you to have their DD 2792 completed, they're going to either come to you with a paper copy of the forms, or they're going to have they're going to provide you with a digital copy of the forms. We request once you've completed your part that you resubmit the paperwork back to the family member. At that time, the family member is going to review the documents to determine that everything written on those forms is correct, and then they're going to sign off on page 3, block 9, A, B, and C, certifying that the information is correct. And then they're going to submit the documents to their local EFMP office, Marine Corps EFMP office, where their family caseworker is going to then review the documents to make sure that all the sections have been completed and everything is signed. And then it'll be submitted to our headquarters EFMP office down at Quantico, where the medical screeners will review the documents to determine whether they meet criteria for enrollment or updated enrollment or disenrollment. So if it's not your process at your clinic to have the submit the DD 2792 back to the family member, you submit it to your EFMP coordinator. We ask that for any Marine Corps sponsored family that the paperwork then be submitted to our office, and then we will coordinate with the family to have the page 3 of the DD 2792 signed off on before submitting it to headquarters EFMP for final review. Okay, so this concludes our presentation today. I want to thank you for joining me today. I appreciate your time and your commitment to learning about the Exceptional Family Member Program, or EFMP, as the role and your role as a medical provider in this process. If you have any questions or you need additional guidance, please feel free to contact me. My contact information is here on this slide, as well as a link to our website where you can find additional information about the Exceptional Family Member Program, or a link to the forms DD 2792 or DD 2792-1. Thank you again. Have a great day.